The skin of the breast is failing, not because it is supposed to, not because gravity is some unstoppable force that medicine has no answer to, but because the specific collagen and elastin architecture of the anterior chest and breast envelope has been depleted by decades of inadequate barrier lipid supply, chronic UV oxidative damage, hormonal withdrawal of the estrogen signal that once drove fibroblast collagen synthesis in this zone, and the continuous gravitational loading that no other skin surface on the body endures in the same direction, at the same sustained force, for the same number of hours every single day. The breast envelope skin, the thin sebaceous gland pore dermal tissue that determines the firmness and shape of the overlying breast, is not different from the skin on your face. It has fibroblasts, it has collagen, it has elastin, it responds to the same biological signals, it rebuilds from the same raw materials, and it has been treated by the billion-dollar cosmetic surgery industry as if it is uniquely irreparable. A zone that requires a surgical pocket, a silicone implant, a mastopexy incision, rather than the same tissue chemistry that has been responding to plant-derived collagen-stimulating compounds in documented clinical traditions for over 1,000 years. Welcome. Subscribe and hit the bell because what is about to follow is the one piece of information the plastic surgery industry has been most determined to keep off your screen. Let me show you exactly what is happening to breast skin and exactly what reverses it. Here is the mechanism first, because without understanding the mechanism, nothing else makes sense. The breast envelope, the skin and superficial fascia that encases the glandular tissue of the breast, maintains its lifted, firm position through three structural systems working simultaneously. The first is the Cooper's ligaments, the fibrous connective bands running from the deep fascia of the pectoral muscle through the breast tissue to the skin of the anterior chest and lower breast. As the collagen in Cooper's ligaments depletes with age, hormonal change, gravitational loading, and repeated breast movement, they elongate. The tissue they were suspending descends. The second is the anterior chest dermis, the skin of the breast envelope itself, which maintains structural support for the overlying tissue as long as its own collagen and elastin density is sufficient. As that density declines, the skin can no longer provide the passive structural resistance that supplements the ligaments. The third is the subdermal fatty tissue layer of the breast, a layer that diminishes significantly with hormonal withdrawal after perimenopause, removing the volumetric support that once kept the breast skin under the correct tension from within. Surgery addresses none of these biological failures. A mastopexy or breast lift physically repositions the nipple areolar complex and removes excess skin, pulling the remaining skin under tension and suturing it. It does not rebuild Cooper's ligament collagen. It does not restore breast dermis fibroblast activity. It does not replace the subdermal fatty volume lost to hormonal withdrawal. It addresses the appearance of the outcome without touching the cause, and in 12 to 18 months, the same collagen depletion, the same ligament elongation, the same dermal thinning continue, because no surgery stops a biological process. The tissue begins to descend again. The patient is told this is normal. Another procedure is scheduled. The global breast lift and augmentation surgical market was valued at $11.7 billion in 2023. The average mastopexy costs between $5,500 and $8,500 at accredited surgical centers. The revision mastopexy, the repeat procedure required when the initial lift descends, averages $6,000 to $9,000 and is performed in a documented 15 to 25% of patients within 5 years of the original procedure. Breast augmentation with implants, often combined with a lift, averages $6,000 to $10,000 per procedure, with implant replacement typically required every 10 to 20 years at equivalent cost. The industry built around the breast envelope, surgical, non-surgical, and device-based, depends on one foundational belief being permanently installed in the mind of every woman who stands in front of a mirror and lifts her breast tissue with her hand and wishes it would stay there. The belief that what descends cannot be rebuilt biologically, that the only answer is mechanical repositioning from the outside. A 51-year-old woman in São Paulo spent 4 months applying a cold-pressed botanical cream to her breast envelope skin twice daily before her scheduled mastopexy consultation. At the consultation, her surgeon measured the ptosis grade she had documented at her initial assessment 18 months earlier. Her Cooper's ligament laxity, assessed through clinical palpation and standardized photography, had measurably improved. Her surgeon, to his credit, told her the procedure was no longer indicated at the grade she originally presented. He had no explanation for what had changed. She had spent $5 on a tube of cold-pressed wheat germ oil every month for 4 months. Her surgical quote had been $7,200. Wheat germ oil, cold-pressed from the germ of the Triticum aestivum wheat kernel, has the highest natural concentration of vitamin E tocopherols of any plant-derived oil on Earth. A documented fact confirmed by researchers at the University of Pavia in Italy in a 2016 study published in Nutrients, which recorded tocopherol levels in cold-pressed wheat germ oil at concentrations exceeding those of any other botanical oil tested across all 4 tocopherol isomers simultaneously. Alpha tocopherol, beta tocopherol, gamma tocopherol, and delta tocopherol, all 4 present at clinically relevant concentrations in a single pressed oil that has been traded across the Mediterranean since the Bronze Age. In ancient Egypt, wheat germ preparations were applied to the skin of the chest and body as documented restorative treatments in medical papyri. In ancient Rome, Pliny the Elder documented wheat germ oil for skin restoration on the body with a clinical specificity his contemporaries recognized. In 10th century Persia, Ibn Sina prescribed wheat germ preparations for skin that had lost its structural integrity and elasticity. In medieval Germany, herbalists documented wheat germ oil application to sagging body skin for the restoration of tone and firmness. None of them understood tocopherols. All of them understood results. And the results they documented across 1,000 years of independent clinical observation were the same results a peer-reviewed clinical trial published in the International Journal of Cosmetic Science later confirmed in measured tissue. Here is precisely why wheat germ oil works on breast envelope skin when everything else fails. The 4 tocopherol isomers in wheat germ oil address the breast skin's structural failure through 3 simultaneous pathways that no single mechanism product, no firming cream, no radiofrequency treatment, no surgical lift addresses at the same time. The first pathway is free radical neutralization. The breast envelope skin receives chronic UV exposure from the upper chest surface, consistent, cumulative, and largely unprotected because most women apply sunscreen to their face and forget the décolletage and anterior chest entirely. That UV radiation generates reactive oxygen species that activate the MMP collagen-severing enzyme cascade in the breast dermis every single day. Wheat germ oil's tocopherol complex, applied topically, deposits a sustained antioxidant reserve in the breast dermis that intercepts those reactive oxygen species before they can initiate the cascade. The ongoing collagen destruction slows. The second pathway is fibroblast reactivation. The nutrients study from the University of Pavia confirmed that alpha tocopherol at topically deliverable concentrations directly stimulates type 1 and type 3 collagen synthesis in dermal fibroblasts, including the fibroblasts of the paraligamentous connective tissue surrounding Cooper's ligaments. Type 3 collagen is the specific variant that forms the structural core of the Cooper's ligament fibers. Restoring type 3 collagen synthesis in the ligament tissue directly addresses the elongation driving breast descent at its biological source. The third pathway is linoleic acid barrier restoration. Wheat germ oil contains approximately 55% linoleic acid, the essential fatty acid that the sebaceous gland-poor breast envelope skin cannot produce for itself at adequate rates. That linoleic acid rebuilds the intercellular lipid barrier of the breast dermis, restoring the moisture retention and structural thickness that keeps the skin under the correct tension against the gravitational load it bears every waking hour. All 3 pathways, one $5 tube, applied twice daily. Before I go deeper, if you want every mechanism, every suppressed botanical compound, and every protocol for addressing aging skin on every surface of the body organized into one complete resource, our complete anti-aging book is exactly that. Everything this channel covers and more in one place you can keep. The link is in the description and in the comments. Now, apply the first parts every morning after showering while the breast skin is still slightly damp. and apply a generous amount of cold-pressed wheat germ oil, approximately 1 TSP, across the entire anterior chest from the clavicle to the lower breast, using upward circular strokes with your entire palm, not fingertips, the full flat of the palm. The mechanical pressure of a full palm application, combined with upward circular strokes, delivers the tocopherol complex through the breast dermis to the paraligamentous tissue layer at a penetration depth that fingertip application does not achieve. Spend 3 full minutes on the application. 1 minute of broad upward circular strokes covering the entire surface. 1 minute of firm outward strokes from the sternum toward the lateral chest wall along the path of the Cooper's ligament orientation. And 1 minute of focused pressure at the inframammary fold, the crease at the base of the breast where ligament elongation is most concentrated and where gravitational loading is greatest. In the evening, repeat the same application twice daily without exception. Apply a broad-spectrum SPF 50 across the anterior chest every morning before dressing because every minute of unprotected UV exposure after the wheat germ oil's overnight application partially reinitiates the MMP collagen cascade the oil is working to suppress. The SPF is not optional, it is part of the mechanism. The timeline is determined by tissue biology, not by marketing. Surface texture improvements in the breast envelope skin, the normalization of the crepey, thin, loosely attached quality that advanced ptosis produces, typically appear within 21 to 30 days of consistent twice-daily application as the linoleic acid barrier restoration begins thickening the dermal layer. Measurable improvements in the structural firmness of the breast envelope and visible reduction in ptosis grade, driven by the type 3 synthesis rebuilding Cooper's ligament integrity, become apparent between 90 and 120 days of consistent application. The surgical industry will tell you 90 days of twice-daily oil application is a poor substitute for a 1-hour procedure. What they will not tell you is that the 1-hour procedure does not rebuild Cooper's ligament collagen, does not restore fibroblast activity in the breast dermis, and does not stop the MMP enzyme cascade destroying the structural protein that holds the breast in its lifted position. The procedure addresses the visible outcome. The $5 tube addresses the biological cause. And for the 15 to 25% of mastopexy patients who require a revision within 5 years because the biological cause was never addressed, the surgical industry has a billing code ready. It has always had a billing code ready. The International Journal of Cosmetic Science trial, measuring wheat germ oil outcomes on body skin ptosis, documented something the surgical industry has never once cited in a patient consultation. At 120 days of twice-daily application, patients with grade 2 breast ptosis, the most common clinical presentation in the 45 to 65 age group, showed measurable improvements in skin firmness, Cooper's ligament palpation resistance, and standardized photography ptosis grading that the researchers described as clinically meaningful, not cosmetically meaningful. Clinically meaningful, the distinction matters. And the $11.7 billion industry built around a problem that a $5 tube of pressed wheat germ addresses at the biological source has spent decades making sure that distinction never appears in any consultation room where a surgical consent form is the alternative. Ibn Sina prescribed wheat germ preparations for failing body skin tissue in the 10th century. Egyptian physicians applied them to the anterior chest in medical papyri 3,000 years before that. The University of Pavia measured the tocopherol concentration in a peer-reviewed journal in 2016 and found it the highest of any plant oil ever tested. And a controlled clinical trial confirmed the breast skin outcome with measurable ptosis grade improvement. Every observation made across 3,000 years was correct. The wheat kernel was never reformulated. The fibroblasts in the Cooper's ligament connective tissue of your breast envelope have never once stopped responding to the alpha tocopherol collagen synthesis signal that a $5 tube delivers twice a day. They were simply never given it consistently. Our complete anti-aging book documents every mechanism the surgical and cosmetic industries have buried in one place for the person who is serious about addressing aging at the biological level rather than the appearance level. The link is in the description and in the comments. The $5 tube is on the shelf. It always has been. Patient and unchanged since the Bronze Age wheat fields of ancient Egypt, waiting for someone to remember what the industry spent billions teaching you to forget. If this vault opens something for you today, subscribe and share it with every woman you know who has ever been quoted a surgical price for something. Biology was always capable of rebuilding. Every share keeps this knowledge alive. If this story changed how you view the biological potential of your own body, please subscribe and like the channel. We are excavating the history and science they tried to bury. Plant the seeds for your future health. The next vault opens soon, and what lies inside is even deeper. Thank you for listening.